All right, welcome to the Nootralize Podcast once again. Today we are chatting with Seth Gillihan, who is a licensed psychologist and the host of the weekly podcast Think Act Be. He's also the author of several books on cognitive behavioral therapy, and he's currently creating a course on how to handle stress and anxiety with CBT. And I'll be linking to all of these sources in the show notes of this podcast. Now, we will be going through the research of CBT, how it compares to cognitive therapy and behavioral therapy separately, and we'll also be going through a live CBT session where Seth coaches me around how I should fix one of my problems that I have in my life. And I think that will be applicable to you as well, because then you can see how CBT is conducted and you can extract the underlying principles from the live example of how a session is conducted. So let's get straight into it. What has the research found on the efficacy of CBT for different problems that people may experience, such as anxiety and mood problems?
Well, so there are hundreds of studies that have been done by now showing that CBT is effective in treating anxiety, depression, substance use issues, obsessive compulsive disorder, post-traumatic stress disorder. The list goes on and on. Now, what's not as often found is a benefit of CBT over other types of therapy. Mm-hmm. So we can say with confidence that CBT is really effective, and most people who do it are going to get a lot of benefit. Mm-hmm. But I would not claim and can't claim based on research that CBT is the only type of therapy that works, or that it's better for all types of issues. There are some where that's clearly been shown, like for obsessive compulsive disorder, you really need a specific type of therapy. You need exposure and response prevention. For OCD, and doing kind of depth work and exploration for most people is really not going to lead to progress for OCD. But for other issues like depression, anxiety, panic, there's some good evidence that other types of approaches work, including psychodynamic approaches.
Mm-hmm. So, is there any evidence that CBT is better than just cognitive therapy or behavioral therapy alone?
For the most part, no. So they do these what are called dismantling studies. So if you have a therapy that's cognitive and behavioral, then you take out the cognitive part and just do the behavioral, then you tend to get about equivalent results, or vice versa. There are studies that pit a mostly behavioral therapy against a mostly cognitive therapy and find generally there's no advantage. So there are different ways we can understand that. One is that if you think of the two as doing similar things, just from different directions, then once you've done one, you don't necessarily need the other. It's kind of like if acetaminophen and ibuprofen are both getting rid of a headache. Once you've taken acetaminophen, then if you also took ibuprofen, we wouldn't say, see, ibuprofen doesn't work. Say, well, the problem was kind of taken care of at that point.
Yeah.
So when you try to get to really fine-grained distinctions in what works in therapy, that's where we generally don't tend to see differences.
Interesting. I thought that CBT was actually the most evidence-backed therapy form, and even more so than the cognitive therapy or behavioral therapy in themselves, but apparently not so.
Well, it's a good question, and it depends on what we mean by most evidence-backed. So I think that it's easy to interpret that kind of phrase, or even to use it to suggest that the evidence is stronger for that type of therapy than for another, or even that there's evidence that one works better than the other. But a lot of times what we mean is just that there have been the most studies done on that type of therapy, which is one type of evidence, and it gives us more confidence. If there are 13 studies showing one treatment works and 2 studies showing another treatment works, you might go with the first one. But we can't conclude from the 13 versus 2 that one treatment is 6.5 times better than the other or something.
Right. You got to look at what's actually in the study.
That's right.
Yeah. I think that is what my intuition about the level of evidence for them was before, that the effect size of CBT helping people with, for example, anxiety disorders is greater than for either of the two parts alone.
I mean, there may be individual studies showing that, but to my knowledge, when you put all the studies together, you don't find an additional advantage for one over the other. Yeah.
So in cognitive behavioral therapy, I know that your podcast is called Think, Act, Be, and those are sort of the three parts of cognitive behavioral therapy, correct?
Well, the three parts of mindfulness-centered cognitive behavioral therapy. So the third wave of CBT has added this mindfulness and acceptance component.
Okay. So what are the three waves?
Well, so think corresponds to the cognitive approach. So that's, when we understand our thoughts, the stories that we're telling ourselves, then it's easier to make sense of our actions, and also easier to examine our thoughts and change them in ways that are going to, be helpful to the way that we think, feel, and act. The act part, obviously, is the behavioral approach. So that includes things like looking at the ways that we're rewarded for certain behaviors, like when I don't go outside because my neighbor's out there and I feel anxious about talking to him, then I get a short-term reward from that. I feel relief, but in the long term, I don't have that close connection, and my fear stays stuck. So understanding those kinds of patterns can help us to practice new behaviors that can free us up and just lead to a more fulfilling life. And then the B part is mindful acceptance and mindful presence. So it's I think of it as the quality of presence that we bring to our thoughts and our actions. So excuse me, I used to think of it as a kind of third option in a way. Like we've got mindfulness approaches. We've got cognitive approaches, behavioral, and now we can also throw some mindfulness in there if needed. But now I think of it more as the groundwork for all the others, that we can bring that type of presence to any other practice or technique that we're working on.
So how do you involve mindfulness or integrate mindfulness into CBT as a practitioner and help as a clinical psychologist, right? How do you help other people do that?
Right. So, I mean, a lot of it is about the spirit in which we approach our thoughts. So we can practice brief mindfulness exercises right in session that will help to center us, to ground us, and also to open our receptivity to notice what's going on in our minds, to increase awareness. That's so much of what CBT is about, and I think that's part of why mindfulness fits so nicely with it. It's really about increasing our awareness of our thoughts, awareness of our actions. So we can approach our thoughts mindfully. We can respond to thoughts mindfully. We can kind of recognize them with some distance, that we're not identical to our thoughts, that we can have a thought that's not necessarily true, that we don't even necessarily believe.
Right.
And same with actions. We can, if we're doing, let's say, some exposure, which is an important approach in behavior therapy. So that means facing the fears that I've been avoiding. We can do that in a mindful way, both in terms of the acceptance part, so accepting that it's going to be uncomfortable, that I'm going to want to flee, and I have a choice in whether I respond to that urge to flee or stay. And also bringing greater presence to that experience, and just allowing myself to be fully in it. So if I'm talking to my neighbor, just being fully in that experience. And when we come into the present, that's a pretty powerful way to get out of the grip of anxiety, because anxiety obviously is focused on the future.
Right. Yeah. Anxiety can also rise, to my understanding at least, and in my experience as well, when you try to do something that you are not, like, that is a bit above your level of competence.
Yes,
Yeah.
definitely. Competence or confidence, both.
Yeah. Yeah, that's true as well. And we talked via email before this podcast about doing a live CBT session, small CBT session, where you coach me.
Yes.
And the problem I want help with is just that I do things that are a bit too hard to me sometimes, which leads to me becoming stressed. And it's not a problem necessarily that I do things that are hard, but that I do them too much sometimes, to the point at which I don't get the time to recover.
Great. Can you give me a recent example, David?
Right. It's just... So, a couple of days ago, I had a lot of tasks on my to-do list, and I just kept working, even though I probably could have stopped working an hour earlier and started working on the same to-do list the day after. So I became stressed during that day.
Yes.
Yeah.
When did you notice you were becoming stressed?
Probably around 6 p.m. So
and you kept working until...
Yeah, 11 p.m.
Oh, another 5 hours.
Yeah.
And what was the effect on you? What was the downside for you?
Well, didn't feel very well, I guess. They weren't tasks that required me to perform cognitively. So, like, they were very monotonous and just work that had to get done, repetitive work. So I don't think it impaired my performance very much, but it didn't feel well.
Okay.
Yeah.
You know, I'd like to lead you through a brief centering exercise, if I could.
Sure.
Is it okay to close your eyes?
Mm-hmm.
Right. I won't be looking directly at you. You'll have to trust me on that.
Mm-hmm.
So take a moment and just settle in. And feel your body where it's resting. Feel your feet on the floor. Feel any sensations in your hands where they're resting. And feel the breath moving in and out of the body. Feel the belly as it rises and falls with each breath. And noticing if there's any tension in the body, any unnecessary holding of the muscles. And if there is, just noticing where that is. Just feeling what's being held. And if the mind goes to thoughts like, I wonder why we're doing this, or I wonder what the point of this is, or I feel silly, or any thoughts at all, just noticing those thoughts, and then gently, without any judgment, bringing the attention back to the body, back to those sensations. Allow yourself to be with the body. Maybe feeling, in a way, you're coming home to yourself. And feeling your feet again on the floor. Feeling your body weight pressing into your chair. When you're ready, allowing the eyes to open. Any reactions to that, David? There are no right or wrong answers. I just want to see what that was like for you.
I'd say that it calmed me a bit.
Yeah. Yeah.
And I think that you have a great meditation guiding voice.
I appreciate that. Well, the sounds of the saws cutting through limestone outside must add to the relaxing quality.
Right.
Of course, that would happen today. Well, let me ask you now, what's your goal with this issue? What would you like to change? How would you like things to be different?
I guess in the optimal situation, I wouldn't have so many tasks that don't feel fulfilling to do. I know that in the long run, it is good if I get these tasks done because it improves the overall productivity of the projects that I'm trying to complete. But if I could delegate some tasks, that would be good, I think, because I want to work all the time if I could work on something that I like.
So is that a goal then you have, to delegate more tasks?
Yeah, that would be a goal.
Okay.
Mm-hmm.
Good. Anything else? How would you, when you reach that point again, 6 o'clock, and you're noticing that you're becoming exhausted, maybe taking on some stress,
Mm-hmm.
anything different you'd like to do in the future?
Yeah, I think that I will take more walks because they are relaxing to me.
Okay, so you would like to stop when you're working and take a walk instead sometimes?
Yeah, because currently I already am delegating some tasks, and in the current situation, the reason why I am doing these repetitive tasks is because I cannot afford to delegate them.
Okay.
Yeah.
Can't afford in terms of?
In terms of money.
Right,
Yeah.
right. So it's that kind of, it's a difficult transition to get to a point where you have enough resources that you can delegate, but how do you delegate until you get those resources, and how do you develop resources when you have to do everything on your own?
Right.
Yes. So let's start out. What I'd like to ask you to do is imagine. So what day was this? Was this recent event?
Well, this last Saturday.
Okay.
Event, yeah.
All right. So it's Saturday. It's 6 o'clock.
Mm-hmm.
Can you picture where you are at the time?
Yeah.
And what are you feeling as you start to notice the stress you're taking on?
I'm feeling that I should be taking a walk because it's going to make me feel better, and probably it's going to be good for my cognitive performance in the long run as well.
Okay, so that was the thought that you had.
Mm-hmm.
And what about the feelings? Anything in your body that you're noticing? Any emotions that you're having?
Yeah, stress and some anxiety.
Hmm.
Yeah.
Where do you feel the stress? How do you know that you're feeling stressed?
It's in my head, I'd say.
Okay. Yeah.
Yeah.
And is that a typical place that you'll feel stress is in your head?
Yeah, and like in my neck.
Mm-hmm. Yeah. Yeah. Very common.
Mm-hmm.
And then the anxiety, same thing, or were there other things that told you you were anxious?
I don't think there were any other factors that would have led to my anxiety.
So you're noticing these feelings of stress and anxiety. You even have the thought, I could or I should stop now, go for a walk.
Right.
Any other thoughts that came up at that time?
Well, that would be that it would be a bit egoistic to have a walk because it feels good for me when what I'm trying to achieve is good for more people.
Wow. Do you have something you can write with there?
Mm-hmm.
Can you write down that thought that it would be egoistic of me to go for a walk, to do something for me?
Mm-hmm. Yep.
Wow. All right. We're going to come back to that. Any other thoughts that came up, and maybe especially the ones that led to you continuing to work?
Yeah, that would probably be that one thought.
Okay. All right. Well, let's focus in there, David, because I think that sounds really important.
Mm-hmm.
So first of all, what's the evidence that that's true, that it would be egoistic? And can you tell me more about what you mean when you say it would be egoistic of you?
Yeah, I mean that I believe that what we are doing here at Nootralize, really, which is what I'm working at all the time, will help a lot of people to experience a lot of well-being in comparison with what they would have otherwise had we not helped them. And so in that regard, it would be relatively egoistic in contrast with the altruistic action of working to help more people than just me.
Right. So could we say selfish? Is that the feeling? It would be selfish of you to...
Yeah.
Yeah. Yeah. And any evidence that it would not have been selfish of you, that it could have been? Is there a different way of seeing the meaning of what taking a walk might have been?
Yeah, so that would be then that I know that I need to take care of myself and my well-being in order to be able to continuously perform cognitively.
Why is that important?
For me to feel well to perform cognitively?
Yeah. What happens if you can't?
If I can't feel well or perform
If
cognitively.
you can't feel well, and then if you're not able to perform up to your ability cognitively.
Yeah. I think that it's per definition bad if I don't feel well, for one thing. I think there's intrinsic value in me feeling well.
I'm glad to hear that. I agree.
And so I think that's true for everyone, every person. And therefore, if I cannot perform for Nootralize, then I believe that will entail that less people will feel good.
So the outcome could be the opposite of what you're intending. The result of continuing to work could actually have the opposite effect that you want.
Yeah, it could. But it's very hard to make the decision of when to quit, because that work has to be done sometime, at some point.
That's right.
Yeah.
That's right. Yeah, and putting it off till tomorrow only works for so long.
Yeah.
Unless at some point you get a double day and you can do 48 hours work in 24 hours.
Yeah.
So I think this is a really important step, identifying that thought. And I'm really glad to know that you recognize that it's not that the story that you identified is not necessarily true, that in fact it might be the opposite of what is true and what's going to work for you. And yet that insight alone, it sounds like, isn't going to be enough to automatically kind of fix this problem next time it comes up. So we're going to need to, and if you and I were working together longer term, this would unfold over more sessions, but we'll need to think about that, finding that balance, because you do need to work hard, and there are times when you'll have to work beyond the point when it might be nice to take a break. But that always has to be balanced against the cost, against kind of what you're borrowing from in order to do that. Because at some point, I'm guessing, do you find at some point you have to pay it back if you kind of overdraw your account, so to speak?
Yeah, slightly. I get very good sleep, so I do recover during nighttime very well.
Good.
Yeah. But some slight such changes in performance, such negative changes in performance happen sometimes.
Yeah. So David, when you kept working from 6 to 11, was it continuous, or did you take any breaks?
Yeah, that's the problem, I think. That I did not, except for dinner at like 7. Yeah.
Okay. Who did you eat with?
With my family.
Oh, you did. So you stopped and you ate a proper dinner.
Yeah.
Good. I'm glad to hear that. I was picturing you, shoving food in your mouth as you're continuing to work, just in a stressful way to eat. And then was there a question after dinner about whether you'd go back to work or pause for the night?
Not really. I was pretty determined.
Yeah. Well, I wonder what it would be like in the future to build in times to pause, where you can assess kind of, how am I doing? Maybe look at your calendar and see where you can, how much you can put off until the next day versus, no, I just need to stay on this track tonight. Because when we're on that working track, it's easy to just keep going. If we don't stop at some point and say, okay, hold on, is this working for me? I definitely have, I fall prey to this a lot myself, just feeling like, just this one more thing, I don't want to do this tomorrow. But then of course I do the same thing the next day and it just gets kicked down the road. So sorry, I buried my question in there, but what do you imagine it would be like if you had those gaps, those pauses, where you could assess sort of where you are and what makes sense moving forward?
Yeah, I think that is the best way to move forward. I think that it could potentially solve the problem. Yeah.
And any concerns about what your willpower might be like at those times, like whether you may set this intention now but find it hard to actually take those breaks when the time comes?
Yeah, I know that when I've had that intention before, because I've thought about that before, taking breaks more often, and when I've had that intention before, it hasn't been done. So I guess that, and I internalizing, or rather analyzing my internal thought process during those times, I believe that was because I didn't believe enough that it would help me.
Right. Yes. Yeah. Yeah. So what you did made sense given what you believed. If you believe it's not going to be helpful and it's going to take away from the mission of Nootralize, then it made sense to do what you did. So we're going to need to build in some more structured breaks. So these, dinner was a great one because I'm guessing your family expected you to join them for dinner. So maybe there are things you can schedule into your calendar, especially with other people where there's some kind of accountability, right? So they're counting on you.
Yeah.
Anything come to mind like that could be, not so long that it's going to, take up the rest of your night, but planned in a way that, they're counting on you.
Right. During nighttime, which is when this problem of becoming stressed often arises, I don't really see any possibility of consistently having someone to do something with. I could do that probably with my family then, I guess.
Yeah, all these things are experiments, so you could try that, see if it works. You can brainstorm other ways to do it. What about do you set timers? Do you have reminders that go off to take a break?
Right. So I try to not schedule things too rigidly so that they have to be done at a specific point in time, because I believe very much in being adaptable and doing them when for example, my cognitive performance is at its peak for demanding tasks.
Good. Yeah, I would think more, less about a timer for a certain time of day and more about a length of time that you work. So, often we'll say, 25-minute blocks are a good amount of time to work and then get up. So you're getting up twice an hour. There are apps, of course, for this. I use one called Be Focused Pro. Just be focused, and you can set it for some number of minutes and it goes off, and you're on task during those 25, and then take a break, move around, stay fresh, kind of regroup for the next block. Just be up for trying that out this week, maybe a couple days a week, seeing what it's like to work with a timer and to take those structured breaks.
Yeah. I'll try it.
Such an agreeable patient.
Right. Yeah. I really try to work on myself a lot. So I guess that's why.
Well, I can see, David, obviously your mission is important to you. I can sense that, and your dedication to wanting to work through it, but also wanting to take care of yourself. And so I really applaud you for wanting to find a way to balance those two.
Right.
Because really, it's one mission. It's your wellness and it's the world's wellness, and those two are not in conflict.
Exactly. Yeah. I agree.
One other thing I wanted to invite you to do, and that is to write down things you want to remind yourself of that might give you a little bit more motivation to take that pause when you need to. So when your timer goes off for your break, you read something that says like, well, let me ask you, what do you want to remind yourself of in those moments? What's going to be, maybe not a guarantee, but at least will increase the chances that you'll take to heart your need to rest.
It's not about now, I'd say.
Great. Yes. Yeah. And what does that bring up for you? It's not about now.
So it means that it's all about the long-term results.
Can I ask how old you are, David?
19.
Oh my goodness. Younger than I would have guessed.
Mm-hmm.
I mean, even younger, I was guessing early 20s just based on the fact that you're doing what you're doing. So, so what I was going to say to you is even more true, which is this is a long road.
Right.
I think I was probably twice your age when I realized that I needed to take self-care and rest seriously. It took a long time to recover from kind of pushing through that point. So you're exactly right. It's not about now. It's about what now has to do with the rest of your life.
Right. Yeah.
Good. Well, let me ask you anything, any other thoughts or questions about this issue for today?
I think I have an action point. Or several. So, no, that is it.
Good. Good. One other thing I'll invite you to do when you are tempted to push through is just notice, are there any other thoughts that come up, besides the one about being egoistic or selfish? So how would you summarize? What do you take from today?
That whenever first of all, I'm going to prevent getting into this sort of situation by using or trying some sort of app that will help me focus, such as Be Focused. And that will enable me to take breaks, I hope. And if I do get the feeling that I should continue to work, then I'll remind myself that me feeling well in the short term is imperative for my long-term performance, which is what is actually relevant in the big scheme of things.
Terrific. Yes. Well, great work today. I think you really, really identified some important things and look forward to hearing how it goes.
Yeah, I'll let you know. And thank you for guiding me.
My pleasure. Yeah, I enjoyed it. I appreciate your willingness to share something that's real for you. I think it makes for a more interesting discussion than have to imagine some made up scenario.
Yeah. So where can people learn more about what you're doing online?
So, probably the easiest place to go is sethgillihan.com. You can find links there to my podcast, which you mentioned. Thank you, the Think Act Be podcast. To my blogs. I blog on Psychology Today, other resources that are there. There's a free e-guide called 10 Ways to Manage Stress and Anxiety Every Day. You just put in your email and you'll get that free guide, and also links to an online course that I just started called Calm Cognitive Behavioral Therapy for Anxiety, Stress, and Worry, which I'm really excited to get started with. That will start on, I'm guessing after this podcast comes out, we're starting on March 2nd, so a week from today.
Right. Yeah. We'll include links to all of those places in the show notes. And thank you for coming on the Nootralize Podcast, Seth.
It's been a pleasure. Thank you, David.